yeah, we'll be just rebuilding on this idea of, and everything we're talking about here today is this big muscle, this serratus posterior. Well, it's not a big muscle, but it's big as far as what its job is in the decompression stance. Everything revolves around decompression breathing and the where's that slide I want here? That one. So, cadaver studies on patients with COPD, this muscle was inactive. So the theory we're working on here, and this is what is taught by foundation training, is that these serratus muscles are going to activate almost like a Chinese finger trap to pry open the spine. So let me just read this here. So when we do decompression breathing as taught by foundation training, we should feel dramatic tension in these serratus muscles. So there's ones up top, ones down below. They're at the transitional areas. So these muscles, these muscles are likely weak or inactive in COPD patients because of abnormal spinal curvatures, because curvature changes at the transitional areas where the thoracic curve turns into the lumbar, thoracic curve turns into the cervical. So that's what we call lordotic to kyphotic. Blah, blah, blah. Just said that. Just read it, Nate. Just read it. So they may only help with breathing when the spine is lengthened. Now, obviously, I think these have other roles. We'll talk about chiropractic and what we see, because no matter what you care about chiropractors, we touch a lot of spines. So it's great to have theories, but then you're going to have all these bodies in front of you so you can feel and test things out and see if what you're thinking here is actually related to what we're seeing. The spine is lengthened, but when they're too weak, they simply just hold on. They're just like little tethers that are holding the rib cage to the spine, making sure that the spinal curves don't get worse, and the rib cage is somewhat opened up. But that's not optimal, right? Because these guys are labeled as accessory breathing muscles. So you might have noticed that in the posture report where we covered accessory breathing muscles, they weren't mentioned because they don't operate like the other ones. And you're probably getting that idea right here. So this limits the ability of the diaphragm to engage, right? Because that's what we've been talking about in all the other videos so far, is that the diaphragm is important. See this guy, he's not going to be able to engage in that diaphragm. So he's going to be breathing from the scalenes. You can't even see there, it's a blurry picture, but that's what you'll see in a COPD patient. Wow, that's a tongue twister. Those scalenes overdeveloped is using the accessory breathing muscles instead of activating the diaphragm. And that's when you get that good length in the spine, challenging all those joints and pumping the cerebral spinal fluid is life, right? Movement is life. Shallow breathing. Eventually, over time, it's like doing tiny little shoulder raises all day. Go do 100 shoulder raises with like 5-pound weights. It's gonna get a little burny, even with light weight. Just breathing can overwork muscles over time. It's these little tiny things over time that lead to trouble. All right. So in summary, these muscles are too inhibited, and they prevent the diaphragm's ability to contract, and accessory breathing muscles will take over. And let's just return, get another picture here. This is probably the best picture I found of them. So they're starting in the cervical spine, come down to the thoracics, and they kind of drop. So they don't attach to the first rib, dropping a segment. So they're kind of a little V-shaped, if you will. You can see how these would pull the ribs down, and these would pull the ribs up, and kind of work along with serratus anterior, which is a little more lateral, attaches to the medial portion of the scapula. So that helps open up those shoulder blades. And then we know, like the cheerleader has a problem with that because she's pinching those shoulder blades all the time. And that's not great for the serratus anterior. And that's not great for the rib cage. It just kind of jams the spine down. It kind of looks good posture-wise, and that's why we've been talking about the cheerleader posture type and the runway model. And we'll talk about what we might see with those two as far as these muscles. So there's that Chinese finger trap idea. So we're calling this like forced expansion. So this is different than diaphragmatic breathing. So you notice people do that when they're laying down, the belly's coming in and out. This one is more like vacuum breathing. You're sucking that belly in, but at the same time, we're not kind of caved in like a lot of people are doing with vacuum breathing. We're trying to pull in, but also lengthen the spine. So this is out of Dr. Goodman's book, True to Form. So he talks about those serratus muscles, serratus posterior muscles, and the diaphragm and how it's related to lengthening and the suboccipital muscles and the sacrum, because we talked about the suboccipital and the sacrum with cerebrospinal fluid and how we need to get those in the right direction. Boom. All right. So T4 syndrome is something we'll talk about, and this is something that appears quite often. People have numbness in the hands. It's not always related to serratus anterior. Sometimes it could be a brachial plexus injury, but sometimes it's due to the thoracic spine and that rib also. And long-standing, like we see here, long-standing organ issues can be all related to, this nerve having pressure on it. It's not just because it's going to the heart, it's going to other things, not just the hand, right? If you have symptoms in the hand, we have symptoms in the rest of the body. So there's some of that referred pain pattern you might see. I know I used to have this on my left. When I used to do push-ups, I'd get it right into that pinky. And this isn't entirely accurate here. What I've been finding on a lot of patients, now that I've been studying this muscle more, is sometimes the spine is curved where the muscles are more taut. So we'll talk about the difference between a muscle being taut and tight, because they can feel the same, and that's the big problem, that people come into the office and it's like, it's right here. The pain is right here where it's taut. So that muscle is more likely to be injured because it's being overstretched. It's almost like in a sprained state, so it doesn't take much to injure it. So in foundation training, what are we doing? We're strengthening these muscles. So they're less likely to be taut. We're shortening them. We're causing them to work together. And I definitely feel it in the decompression stance. You should feel it. I do feel it a lot in this area because I'm more of the cheerleader type, and I'll explain why that is. But I definitely, when I focus, I can get it in both areas, expanding that ribcage. And that's what you want. You want equal pull. Because the role model and the cheerleader are kind of doing the opposite when it comes to this muscle. We'll get into that a little bit. But this might not be accurate. You might see the curve, lateral curve of the spine the other way. And that brings me to another point, that this muscle might have a lot to do with proprioception. So we talked about, I think it was episode 2, was mechanoreception. We talked about nociception. So mechanoreception has a lot to do with proprioception, stimulating a muscle in space so we know what it's doing, because otherwise we could have a lot of these curves in the spine and feel like we are straight, and then we lay on the table and your legs are off to one side. So blah, blah, blah. Okay, there's just a little bit about T4 syndrome. If you really want to pause it and read, this video will be out on the YouTube channel. So trying to keep it rolling, keep these videos short. Here's some of Nathaniel's drawings. When I'm bored, I like to draw. It helps me to visualize. Like I said, this might be related to some of the things we're seeing with scoliosis. And there's another cool picture that you'll see with these muscles that a little more accurate with that. Someone who actually has time to draw the vertebrae. But here's what the cheerleader might look like. And we'll see this dipping sometimes. And sometimes it's lower, that what we call the Pottengers Saucer. I think we got a little, here we go. Right there. And that's that, because that cheerleader, she's forcing her shoulder blades back before really fixing this problem. So way too much lordosis in the low back, and that leads to problems with these muscles. Overworking one area, underworking the other. Here's a one-way model. You can see that the ear, no way isn't lining up with the hip. So we talked about how they have pelvic floor issues because they have foundational issues, because the foundation is not supporting the structure. At least with the cheerleader, she's kind of where she needs to be. This is the lazy upper cross, lower cross syndrome, which you haven't really talked about, but it's just like a combination of the two where they're just not really trying. Runway model and cheerleader, they think they have good posture. They think they're doing what's right. The lazy person, they know they're not trying. But they're actually kind of almost in the right position. But too much curve in the low back, too much curve in the thoracic spine, usually it's going to be, everything is just compressed, right? And that means the rib cage will be compressed. So what we want is a little bit more on the left. Lengthened spine, but we're still maintaining the curves. Like with the cheerleader, she's probably going to be flattening out this upper area. It's going to look a little distorted, probably not that crazy, but I do see a lot of things that I'm like, how do you even stand like that? I'll try to stand like people stand. It's like, wow, that is tough. And that lets you know, I said that in other videos, You might know what posture type you're in by trying to hold different posture types. The one that's easy is probably one of the most comfortable is probably what you are. And the one that's hard to get into, for me, it's hard to get in the runway model. And that's a lot of like CrossFit is very similar. They kind of take that similar to a runway model posture. And you see different things there. Trees or telephone poles. I was trying to make the case there because that COPD thing, they're studying dead bodies. It's like things going to occur here, but that can cause distortion here, leading to this if we're overactivating. Because a lot of times we'll distort the spine so we can breathe from a certain muscle better, but then it locks out the use of other muscles. So that's usually what I've been seeing is with the cheerleader, overusing that top one, creating other issues, and then underusing the serratus posterior inferior, which is why the diaphragm has issues. Because if this is too curved, the diaphragm's going to have a lot of trouble activating. Pelvic floor is going to be okay, usually with the cheerleader posture. More stable there because the hips are underneath her. And this could be guys too. I always say like, it's the cheerleader, I refer to as her. And people are like, well, it's just talking about women. This is men, all right? This is me. I'm the cheerleader. Never did cheerleading in my life, so don't make fun of me. But there's that little saucer. All right. And there's the COPD, upper cross, lower cross syndrome. You can see how they're a little similar. They both kind of have a similar foundation, so they're both going to have diaphragm problems. But in certain ways, they're going to have a lot of the same degenerative breakdowns. So it's try smarter, not harder. The take home. I thought this was cool. It's just a picture I had before. I'm like, well, let's measure out because, what is it, 5, 4, 3. So it attaches to the second lumbar. And you can see right where the apex of that curve is where serratus posterior inferior is attaching. So when we're looking at things like scoliosis, because if there's scoliosis, there has to be some torsion, some twisting. You kind of see that here as well. And a lot of us have these lateral curves in our spine and torsion, and we don't know that they're there, and they can be really subtle, and sometimes you won't even see them until you get an x-ray. And I'm not saying go out and get an x-ray so you could know. I'm just saying, like, just assume that there's things there. And the more we strengthen our spine, even if we can't fix these scoliosis issues, the stronger the spine, the less over time gravity is going to distort the curves of the spine. The more we can stimulate both sides of these muscles. And a lot of the foundation training, we're kind of doing some twisting motions, and that's good. You'll figure out right away what's harder for you to do. Okay, this split stance, doing this decompression lunge on the left is way harder than doing on the right. So you want to focus on that left. And that's good. You're only spending about 5 minutes doing most foundation training exercises, so it's not that hard to fit into your day, right? You're not spending hours on this. When you're first learning it, you kind of have to put it in the time so you can kind of do these things right. And I've been doing exercises like this before I found out what foundation training was, but the rhomboids, and I think that has a lot to do because the rhomboids attaching to some of the same spots in the spinous process here, but serratus posterior goes to the ribs, so lifting the ribs, not the shoulder blades. So I don't want you to be confused on that aspect. A lot of people raise their shoulders to breathe. Well, pretty much anyone I ask will raise their shoulders to breathe. And sometimes I won't beat people over the head with it. I just kind of like, all right, take a breath for me. I won't say anything. You're just like, good. But you raised your shoulders. I just don't want to get into this half-hour long conversation about how dysfunctional that is. It's for my own little case study. If I ask you to breathe and I don't say anything, it's because I just don't feel like getting in a long conversation with you. It's not because I think you're dumb or anything. It's just like I don't want to go there. I can't do it with everyone. So rhomboid muscles will pinch the shoulder blades, which is good. It's a good function. Rhomboids could definitely be weak if someone has a lot of COPD and the pectorals are really tight, which would pull the pectorals or lats would pull the shoulder blade internally. But at the same time, we are kind of spreading the shoulder blades more than you would think. It kind of feels backwards to a lot of people. As we expand the rib cage, we're pulling those shoulders out and expanding the rib cage 360 degrees. So a lot of people will pinch their shoulder blades back and then try to expand, and it's not working because they're doing one step and doing the other. And this is kind of everything together as one. So it could be that the rhomboid is overstretched as well. The pectoral is pulling too much, and the serratus is like, oh, proprioceptive wise, I need to engage, try to limit the movement of the spine. That could be what we're seeing here. There we go. Yeah, rhomboids can be overpowered by the lats, pull on the spine. A lot of different presentations that I've seen. So just some of the chiropractic notes, what we're looking at as far as your spine. So we mentioned before that, the lazy rounded posture, these muscles are just going to kind of be like tethers holding the rib cage to the spine, and really not going to be activated in the cadaver studies. And I think we mentioned that. There's some of those links there. I know you probably can't click on those, but I'm sure if you just looked up something, you would find them. If I can find them, you can find them. They don't have like special credentials that let me find, case reports and stuff. All right. So what am I trying to say here? So the spine may extend in the thoracolumbar junction to bring the ribs down and back. So that's what we call depress. They should be able to pull the ribs down and back. That's what you're trying to do. But if the spine is too curved, you notice that you kind of have to lengthen and then pull them down and back. So I'll definitely lengthen the spine first. I'm doing a little bit of rib expansion, but then I think about breathing. So the transversal spinalis muscles, those little muscles in the canal, if someone ever ran their fingers along either side of your spinous process, you'll feel a little canal there. So it usually tends to be where it's rounded the most is where there's lots of atrophy and they're not doing their job. They might feel tight because, again, it could be that little taut thing. They're little tiny muscles. There's lots of ones. Multifidus is the most common one, but there's other ones that are really important. And anything that attaches to the spine, I feel, is super important. So you might notice that these are opposite. And the thing that interested me is that this is kind of dorsal curve where serratus, posterior superior, attaches, and this tends to be, unless you're super role model-y, a little more lordotic curve where the inferior attaches. So that way they attach on opposite of the convex concave origin. I guess that's why I labeled it that. I know I should read my notes before I do this, but I get up in the morning and I'm like, all right, let's do that PowerPoint thing, that you made a week ago. So lazy over the weekend. It's Monday when I get into it. So if the superior is pulling harder than the inferior, kind of we mentioned before, or vice versa, they can inhibit each other. And, it's the same with, like, if your quads are too strong, they're going to inhibit the hamstrings, or called the antagonist muscle. These guys really aren't antagonists. They should be synergists. They should be working together, but they can be, right? They could be antagonists. So, yeah, we mentioned this before. The cheerleader, going to have taut posterior serratus inferior, and, or, did I say that right? That might be backwards. That's backwards. Whatever. But this is an optical illusion where the cheerleader looks upright, but the extension in the thoracolumbar area overstretches the inferior, and the superior isn't being used to expand the ribcage. That's a mouthful. What it's saying, because I understand this, because I was this person, so I was a chiropractor, like, have good posture. So I would just extend everything, and I see so many people do this, and they think they have great posture. And I'm like, I was you. I know what I'm talking about. More than this picture shows, where the pelvis is really tucked posteriorly, usually tight hamstrings. The iliopsoas tends to be taut. It's not that it's underworked; it's just worked in a weird way. We'll say that. And everyone thinks their iliopsoas is tight, and it could very well be taut. If you're very athletic hip, you're very lower cross, cheerleader, it might very well be tight. But stretching that, even when they stretch it, they don't change the curve, right? we're talking about the cheerleader again, they still keep this, well, either way, I guess, either it's too lordotic or it's too flat. So you need to get the spine in the right position and then stretch that iliopsoas. And also activate the iliopsoas, especially if you're the runway model. You need to strengthen that because the pelvic floor is going to get damaged if you don't. Opposite pattern, they have better breathing, like we talked about. The diaphragm is going to work a little bit better on these CrossFit guys and gals. But the thing you'll notice is they have a lot of damage here. They're just jammed up, stoved up right in here because these guys are just hot. They're using everything else. They're using the rhomboids a lot too, kind of like the cheerleader, but they're also using the traps. They're more lifting the spine, if you want to think about it that way. The cheerleader kind of compresses, kind of lengthens the neck, but overall the runway model is good at kind of lifting, almost like, imagine like they're doing a deadlift. That's kind of what they're in a constant state of deadlift. They're at the very top. They're up at the deadlift. The hips are forward where the bar is resting, and they're kind of lifting. You're using their shoulders to lift it. And deadlift, like I said, could be really good, but don't let those hips go forward. That's what I'd say. You want the glute squeeze, but keep that tension on that hip flexor, right? Because you're definitely using that hip flexor, or you should be, if you're keeping a little bit of curve in the spine, not flattening out, because then you're using the back, other things. You should have tension in the hamstring, engagement in the hip flexor. Hip flexor. I didn't read any of these words, but I'm going to assume that I said something along that line. I don't even know why I write things down. Complete waste of my time. I think we're at the end here. I don't think anyone made it through this. I know I wouldn't blame it for people watching 1 second of this and just walking away, but it's for my own good, right? Because this helps me learn. So here's a bit of me doing the decompression stance. You can see I'm kind of hinged, right? And I like to create a little curve in my neck and lift. You can see that SCM kind of sticking out there. I don't know, that picture's so blurry, but serratus lifting and pulling, Chinese finger trap, anterior serratus, which attaches to the front ribs here and there. So for me, I really need to focus on squeezing those glutes, not having a lot of arching. Foundation training, they'll call that extension. Don't be too extended in the founder positions and all these exercises, but it should be really getting those hips. You need those hips engaged, that spine lengthened. Then when you breathe, you can really pull on those. Probably should add another picture where you can see them working, but I guess I'll make a video doing some breathing exercises soon. And we talked about the rotator cuff in the last episode. I should have mentioned that more here, but yeah, that's the same picture. So check out that one, because the rotator cuff is very important because hypervolting guns. Gonna be starting a new thing at Ridgeline Fitness. It's gonna be awesome. Doing stretching, advanced stretching, trying to work on a lot of these tight areas and postures and letting you know what you are. Really analyzing the posture, breaking it down for you, explaining it, what you're dealing with. But anyways, what was I saying? Rotator cuff. We need to pull, just as we're pulling the hip into the socket, we're pulling the shoulder into the socket. And that, both engagement there, and we haven't done the video on the hip yet, but it's the same idea as the rotator cuff. These muscles help pull into the socket, and then that helps us not use the shoulder, because that's why I kind of have that sphere of tension. I'm pulling my arms down. That's me pulling that, activating that rotator cuff, locking that shoulder in the socket, actually actively pulling the arms down. So when I breathe, it's coming from my spine and not from my shoulders. So breathing should kind of feel stiff and restricted when you're doing these types of exercises. And breathing is involuntary, right? So I don't want you thinking about it all the time. It's just when we practice, we're strengthening what's weak. So your body will naturally, because it's involuntarily,